Dylan Scott stands in the operating room, treating a 10-year-old boy named Darius for a broken arm. The boy's father, Terrell, watches with visible hostility. Years ago, Dylan was a police officer who personally arrested Terrell, ending their friendship and leaving a permanent scar of resentment. During the procedure, Dylan discovers an unexpected mass. The pathology report confirms the boy has synovial sarcoma, an aggressive and deadly soft tissue cancer. When Dylan delivers the news, Terrell's distrust turns into a complete shutdown. He refuses to believe the diagnosis and halts the surgery midway, demanding a different doctor. He cannot separate the surgeon from the cop who put him in handcuffs. Dylan exits the surgical suite and finds Terrell in the corridor. He strips off his white coat, discarding his medical authority to speak as a man. He confronts Terrell with the cold reality: the cancer is moving and the boy is still under anesthesia. Dylan admits his failures as a friend, but refuses to let Terrell's pride kill his son. He issues a final ultimatum, forcing Terrell to choose between a decades-old grudge and his child's survival. The tension in the hallway is absolute as the two men stare each other down. Finally, the weight of the facts breaks Terrell's resistance. He signs the consent form with trembling hands. Dylan returns to the operating room, picks up the scalpel, and begins the excision to remove the tumor, fighting to save the life of a child whose father still hates him. A doctor unmasks an illegal plastic surgeon operating in secret within the hospital. The discovery reveals a second victim, Alexandra, who is currently facing a lethal silicone embolism. Halstead boards a mobile stroke unit to begin an emergency intervention while the vehicle is in transit. The environment is hostile, the power supply is failing, and the ambulance cannot stop or return to the base. Every vibration from the road threatens to shift the embolus and cause instant cardiac arrest. Halstead prepares for a blind extraction. He inserts a catheter, attempting to navigate the patient's internal vessels without a direct line of sight. At the hospital, Stevie monitors a sequence of serial CT scans, serving as Halstead's remote eyes. She translates the flickering data into verbal directions, guiding the metal wire through the patient's heart. The power level on the mobile unit drops to critical levels. The internal monitors scream as the embolus moves toward the pulmonary valve. The margin for error disappears. If the silicone enters the valve, the patient's lungs will fail immediately. Stevie provides the final set of coordinates over the radio. Halstead maneuvers the catheter with mechanical precision, hooking the obstruction seconds before the valve closes. He pulls the wire back, clearing the blockage. The patient's heart rhythm stabilizes. The technical gamble pays off. Halstead sits in the cramped, dimly lit cabin as the ambulance continues its drive. The immediate threat of death neutralized by a wire and a remote screen. Liza Martin is 12 weeks pregnant and refuses to be treated by Dr. Hannah Asher. She has discovered Hannah's history of drug addiction and demands a different physician. To Liza, a recovering addict is unfit to touch her child. Hannah retreats, but the hospital's routine is soon shattered. A nurse finds Liza collapsed on the floor. Her blood pressure is dangerously low, and her body is losing fluids at a lethal rate. The emergency team suspects sepsis and prepares for aggressive antibiotics. Hannah returns to the room and ignores the previous insults. She observes Liza's tremors and the specific nature of her physical distress. She recognizes the symptoms because she has lived them. This is not an infection. It is acute opioid withdrawal. Liza had stopped using drugs cold turkey the moment she learned she was pregnant. She believed she was protecting her baby, but the systemic shock is causing her body to shut down. Hannah performs a targeted ultrasound. The screen shows the fetal heartbeat, still steady despite the mother's collapse. When Liza regains consciousness, Hannah confronts her with the medical reality. She does not use clinical detachment. She tells Liza about her own struggle with recovery. She explains that the stress of withdrawal is more dangerous to the fetus than a controlled medical taper. The woman who once spat insults at Hannah now looks at her with desperation. Liza admits the truth and agrees to supervised treatment. The doctor's greatest shame becomes the patient's only hope for a healthy birth. A gunshot victim arrives at the hospital with a severe leg wound. He needs an immediate angiogram to locate a femoral artery injury, but the facility has run out of contrast dye due to supply chain issues. Resident Kai Tanaka-Reed suggests a risky workaround, using carbon dioxide as a substitute. Senior surgeon Crockett Marcel warns of the danger, but the procedure begins. As the CO2 enters the arterial system, disaster strikes. A gas bubble bypasses the intended site and travels directly to the patient's heart. A vapor lock forms, blocking blood flow. The monitors scream as the patient's oxygen levels and blood pressure plummet. Kai freezes, unable to explain how the gas moved so fast. Marcel intervenes immediately. He ignores the complex machinery and uses raw physical force. He lifts the patient's torso, tilting the body to a specific angle while delivering sharp, rhythmic strikes to the man's back. He is fighting to break the bubble and force the CO2 to dissolve. After agonizing seconds, the vapor lock clears, the heart rhythm stabilizes. In the operating room, Marcel discovers the cause of the anomaly. The bullet hit both the artery and the vein, fusing them into an arteriovenous fistula. This internal bridge acted as a high-speed lane for the gas to reach the heart. Later, Kai approaches Marcel, asking for credit for the CO2 idea. Marcel stops him cold. He doesn't offer praise, he delivers a reality check. He tells Kai that his arrogance nearly ended a life, and his workaround was a near-fatal mistake. A mother and her 9-year-old son are rushed into the emergency room following a high-speed vehicle collision. The boy Henry suffers from a distal radius fracture, but his mother Jenny refuses all medical intervention. She displays extreme paranoia, accusing the medical staff of being debt collectors and agents of a conspiracy. Her aggression escalates until security is forced to restrain her. The medical team views her behavior as a clear case of late-onset schizophrenia. To protect the child, the hospital initiates a psychiatric hold and moves to strip Jenny of her parental rights so they can legally treat Henry's arm. Dr. Charles observes a peculiar pattern in Jenny's outbursts: brief, silent lapses in consciousness that do not align with typical psychosis. He overrides the psychiatric diagnosis and orders a forced CT scan to check for organic brain damage. Despite a critical shortage of contrast dye in the hospital, the scan proceeds. The images reveal a hidden mass in her mediastinum. It is a tumor. This growth has triggered a rare autoimmune response, sending antibodies to attack her own brain. Her insanity is not a mental defect, but a physiological symptom of a life-threatening growth. Jenny undergoes immediate surgery for a tumor resection. Once the mass is removed, the autoimmune attack ceases and her mind clears. She regains her senses and reunites with her son in the recovery ward. The terrifying madness evaporates, replaced by the reality of a mother who was a prisoner of her own biology. As they embrace, Henry's jar reveals a final transformation. The chrysalis he carried through the wreckage has finally opened, and a butterfly takes flight. Albert struggles for air in the emergency department. Advanced ALS has paralyzed his diaphragm, and a massive mucus plug now seals his lungs. His oxygen saturation crashes to 70%. Despite the looming suffocation, Albert points to his medical records. He has a signed "Do Not Intubate" order. He refuses to spend his final days tethered to a machine. Dr. Archer ignores the legal boundary, prioritizing the immediate threat of death. He prepares a bronchoscope to suction the lungs. The procedure is a desperate gamble. During the attempt, Albert's breathing stops entirely. A resident tries to intubate, but his lack of experience shows. He fails to find the vocal cords, wasting precious seconds while Albert's skin turns gray. Archer seizes control. He demands a glide scope, using the video feed to navigate the collapsing airway. He forces the tube down, bypassing the obstruction and restoring the flow of oxygen. The monitor pings as his vitals return to normal. The immediate crisis ends, but a deeper conflict begins. Albert regains consciousness and immediately feels the ventilator forcing air into his chest. He cannot speak, but his eyes communicate total devastation. This machine is the one thing he feared more than death. Archer has successfully cleared the airway, but he has violated the patient's ultimate wish. The room remains cold and silent. The doctors have saved Albert's body, but they have stripped him of his dignity. Albert is alive, trapped in the exact mechanical prison he tried to sign away. Omar Thomas loses his grip on the climbing wall and plummets to the floor. In the emergency room, he is trapped in a relentless cognitive loop, asking the same questions about his legs every few minutes, as if for the first time. Doctor, Charles initially suspects a psychological break or a severe concussion, but the patient's physical symptoms suggest a deeper mechanical failure. Dr. Asher conducts a focused neurological exam and discovers a critical anomaly. Omar's eyes are locked in a fixed position, completely unable to track movement horizontally. A high-resolution MRI scan of the brain finally identifies the source of the dysfunction, a microadenoma on the pituitary gland that has suffered an acute hemorrhage. Further blood tests reveal that Omar has been living in a state of chronic malnutrition, starving himself to maintain the lean physique required for elite climbing. This extreme dieting led to a profound vitamin B1 deficiency, leaving his neurological system vulnerable. The doctors determined that a sudden spike in blood pressure during his morning climb triggered the bleed, which placed direct pressure on the cranial nerves. The medical team immediately begins a high-dose regimen of B1 supplements and targeted neurological stabilization to arrest the internal bleeding. As the chemical balance in his brain is restored, the memory loops finally cease. Omar emerges from the mental fog, forced to confront the reality that his pursuit of physical perfection had triggered a near-fatal collapse of his own biology. Dr. Manning clashes with the hospital administration over her aggressive treatment of a young patient. The boy's parents refuse all medication, but Manning is certain the child is dying. She takes an extreme step. She locks the boy inside a treatment room and bars the door. Ignoring hospital protocol and the law, she forces an IV into the child's arm to administer medication against his parents' will. The hospital board issues a formal warning. The parents demand her immediate arrest. While Manning faces an internal review, the boy's condition takes a violent turn. He begins coughing up blood. The situation escalates from a legal dispute to a medical emergency. Police officers arrive at the hospital to take Manning into custody for assault. She ignores the police. Manning pushes past security and returns to the boy's bedside. She performs an emergency endoscopy, threading a camera probe into the child's airways to inspect the respiratory damage. The monitor reveals the truth. The boy's lungs are suffering from massive internal bleeding and inflammation. It is not pneumonia. It is granulomatosis with polyangiitis, a rare and lethal autoimmune disorder. Manning initiates plasmapheresis to filter the toxins from the boy's blood and regulate his immune system. The blood washing procedure stops the hemorrhaging immediately. Faced with the fact that Manning's defiance saved their son's life, the parents withdraw their lawsuit and the police drop the charges. The hospital board cancels the disciplinary action. Manning leaves the ward, having broken the law to ensure her patient survived. David Bridges arrives at the emergency room with a ruptured spleen and massive internal bleeding following a high-speed car crash. His parents, devout Jehovah's Witnesses, immediately present a no-blood card and refuse a life-saving transfusion. They stand by the bed and pray while their son's blood pressure collapses. Dr. Halstead refuses to accept the medical stalemate. He reviews the toxicology report and discovers David's blood alcohol level is 3 times the legal limit, accompanied by traces of marijuana. Halstead then unbuttons David's gown to reveal a Holy Trinity tattoo on his chest, a symbol that directly violates the core doctrine of his parents' faith. Halstead presents these findings to the surgical team as evidence that David has abandoned his religion. He argues the no blood card is an outdated document signed when David was a minor and no longer represents the patient's current life. Based on this logic, the doctors override the parents' instructions. They rush David into surgery and administer a full blood transfusion. Believing their son is now spiritually tainted, the parents leave the hospital. When David regains consciousness, the medical success results in a total psychological collapse. He reveals the tattoo was a youthful mistake he intended to remove, and the alcohol was a lapse in a journey toward repentance. He was desperate to return to his faith. By forcing the blood into his veins, the doctors have permanently excommunicated him from his family and his God. David screams in his bed, realizing that his physical survival has cost him his eternal salvation. A Domino transplant binds 2 families in a life-for-a-life agreement. The plan is clinical. One family provides a kidney to save the other's son, and in exchange, they receive a compatible organ for their own. But the arrangement shatters when Dan Schiller dies on the operating table from sudden complications. The medical team performs chest compressions until the lead surgeon calls the time of death. Bill Schiller, the grieving father, immediately attempts to void the contract. He holds medical power of attorney and issues a formal retraction of consent while his wife is still under anesthesia. He demands the surgeons stop the procedure. To Bill, the deal died with his son. He refuses to let his wife lose an organ to save a stranger when his own child is gone. Inside the operating room, Dr. Marcel stands over the donor. The kidney is already detached and sitting on ice. The hospital's ethics committee and legal counsel convene instantly to resolve the deadlock. They review the signed agreements. The committee delivers a cold, factual verdict. Because the kidney has already been removed from the donor's body, the hospital is now its legal caretaker. They rule that the donor's original intent was to save a life, and that mandate remains binding. Bill's grief does not grant him the right to terminate a life-saving process already in motion. The hospital overrides the father's retraction and orders the transplant to proceed. Mike, the second patient, receives the organ. One family prepares a funeral, while the other receives a second chance at life, forced through by a clinical, legal mandate. Natalie treats a sick infant named Sophie and uncovers a series of lies. Philip, her current partner, is exposed as a pathological liar. He claimed to have no family, but his sister reveals he abandoned his own daughter at the hospital. Philip has even signed a DNR order, instructing doctors not to save the child if her heart stops. Natalie refuses to comply. During a complex heart procedure, Sophie develops pulmonary edema. Natalie ignores the legal threats and implements VA ECMO to keep the girl's heart beating. The high-stakes medical crisis triggers a breakthrough in Natalie's memory. The fog from her accident clears. She realizes Philip manipulated her during her recovery and that she had cruelly discarded her ex, Will. Overcome with guilt, Natalie finds Will on the hospital rooftop. She cries and apologizes, confessing that she finally remembers the truth and still loves him. She asks for a second chance, but Will remains cold. He tells her that their history is nothing but a cycle of hurting one another. He admits that after she ordered him to stay away, his life actually improved. He looks at her without a trace of longing and states that for the first time, he feels free. Will walks away, leaving Natalie alone in the dark. She has regained her memory only to realize she has permanently lost the man she loves. Jordy arrives at the emergency room following a car accident. He is 16 years old and has Down syndrome. While initial exams suggest minor whiplash, Jordy reports a persistent tingling sensation in both hands. Dr. Halstead orders an MRI to investigate further. The scan reveals atlantoaxial instability, a congenital condition where the top 2 vertebrae are misaligned. This instability makes Jordy's spinal cord extremely vulnerable to injury. The medical team presents the father, Russell, with 2 options. A halo vest offers a safe recovery, but permanently ends Jordy's career as a figure skater. Surgery can stabilize the spine and allow him to return to the ice, but it carries a high risk of permanent paralysis. Fearing for his son's safety, Russell chooses the brace. He refuses to authorize a surgery that could leave his son in a wheelchair. Jordy's reaction is immediate and desperate. He refuses to accept the brace, pleading with his father to let the doctors fix him. He shows his father a video of his recent skating performance. On the ice, Jordy moves with a precision and freedom he does not possess on land. He tells his father, "I want to fly." Russell watches the footage and recognizes that his son's identity is tied to the rink. He realizes that by choosing the safe path, he is taking away the only thing that makes Jordy feel free. Russell reverses his decision and signs the consent forms. Dr. Abrams performs the high-stakes surgery. The operation is a success. Jordy retains his mobility and regains the right to return to the ice. He is no longer a patient. He is an athlete again. April collapses on the emergency room floor. Her abdomen is distended and her lungs struggle for air. The medical team identifies the crisis, ovarian hyperstimulation syndrome. In a desperate bid to ensure her IVF treatment succeeded, April doubled her hormone intake, causing massive fluid buildup. Her fiancé, Dr. Ethan Choi, watches his partner gasping for breath. He loses his clinical detachment and tries to take over the procedure, but Dr. Asher forces him back. Ethan is relegated to a spectator as Asher inserts a large needle into April's abdomen to drain the fluid. The procedure works. April's vitals stabilize, and the immediate danger recedes. Ethan stays at her bedside, offering a deep, emotional commitment to their future and the child they both want. He forgives the risk she took with her life. However, April does not respond with relief. Overwhelmed by guilt, she delivers a confession that destroys the moment. She admits that on the very night Ethan proposed to her, she kissed their colleague, Crockett Marcel. The silence in the room is absolute. Ethan's expression shifts from devotion to cold shock. He stands up and walks out without a word. In the hallway, he spots Crockett and immediately attacks. He lunges at the surgeon, and the two men grapple near the nurse's station. Security and staff rush in to pull Ethan away as he vents his rage. The medical victory is erased by a total collapse of trust, leaving the department in chaos. Evelyn Myers arrives at the emergency room in acute renal failure. Her husband, Elliot, presents a signed advance directive. The document is explicit. No dialysis, no intubation, and no life-saving measures. Dr. Will Halstead argues for immediate intervention, but the legal barrier is absolute. Dr. Charles, the head of psychiatry, performs an evaluation and confirms that Evelyn's Alzheimer's has stripped her of all decision-making capacity. The hospital is legally bound to follow the written will. Evelyn's condition deteriorates as pulmonary edema sets in. She begins to suffocate. In a rare, sudden moment of lucidity, her eyes clear. She recognizes her daughter, Molly, and speaks her name for the first time in months. Evelyn looks directly at Will and begs him to save her life. This verbal plea directly contradicts her legal directive. Will ignores the document. He orders ketamine and forces a breathing tube down her throat, overriding the husband's protests. The hospital administration convenes an emergency review. The verdict is cold. A temporary flash of cognition does not legally reinstate a patient's capacity to override a pre-signed directive. Will is reprimanded for a fundamental breach of protocol. By choosing to save her body, he has permanently erased Evelyn's final act of self-determination. He kept her heart beating, but he silenced her last autonomous wish. Will saved the patient, but the hospital board records the incident as a total failure of medical ethics. Marcy Barton arrives at the emergency room 19 weeks pregnant and suffering from vaginal bleeding. Doctors diagnose her with placenta previa, a condition where the placenta covers the cervix. The situation is critical, but Marcy reveals a complicating factor. She has stage 4 brain cancer. This pregnancy is her last chance to have a child. Despite the medical risks, she refuses to terminate the pregnancy, demanding the doctors do everything to keep the baby alive until it reaches viability. As her condition worsens, Dr. Asher proposes an abdominal cerclage to stitch the cervix shut. The procedure is extremely dangerous due to the placenta's position and Marcy's internal bleeding. Marcy accepts the risk and orders the team to proceed. In the operating room, the surgeons complete the stitch, but Marcy's blood pressure collapses immediately. She begins hemorrhaging uncontrollably. The heart monitor signals VFib, indicating her heart has stopped its effective rhythm. The medical team triggers the massive transfusion protocol, rapidly pumping blood into her system to replace what she is losing. Dr. Asher is forced to cut the cerclage she just finished to perform an emergency hysterotomy. The team begins manual chest compressions and delivers repeated electric shocks to her heart. Despite the aggressive intervention and constant transfusions, the blood loss is catastrophic. Marcy's heart fails to restart. The surgeons stop their efforts and declare the time of death at 18:04. Marcy dies on the table, having traded her life for the hope of her child's survival. Ramona spots Dr. Charles in the hospital corridor and immediately develops a pathological fixation. She returns home and ingests malathion, a high-toxicity organophosphate pesticide designed to cause rapid respiratory failure. Emergency services transport her back to the hospital as her body begins to shut down. In the trauma bay, the medical team runs an urgent toxicology screen, but the results show nothing. The specific chemical compound evades standard detection. Ramona's condition deteriorates. Her pupils pinpoint and her lungs fill with fluid. Despite the agony, she maintains a calculated silence. She rejects all medical intervention and refuses to identify the substance to anyone except Dr. Charles. She is using her impending death as a bargaining chip to force his personal attention. Dr. Charles is called to the ER. He enters the isolation room and confronts a girl who has turned her own survival into a lethal game of leverage. He recognizes the pattern of morbid attachment and agrees to a psychological pact. pact. He will continue her treatment only if she reveals the toxin. Ramona smiles and names the pesticide. The staff immediately administers Duodote, a specialized nerve agent antidote to stabilize her vitals. However, the control is an illusion. During a chaotic emergency with a neighboring patient, the surveillance on Ramona falters for less than a minute. She detaches her IV lines, removes her monitors, and slips out of the room. By the time security is alerted, she has vanished into the city. Ramona is no longer a patient. She is a predator with a deadly obsession. Natalie realizes the LVAD is failing her mother. The device can no longer sustain her heart, and her condition is deteriorating. Desperate, Natalie turns to Will, asking him to secure her mother a spot in a new drug trial. Will brings the request to Dr. Varani, but the response is a firm refusal. The trial enrollment is closed, and Varani insists that adding a new patient would compromise the integrity of the clinical data. Natalie's options disappear until a trial patient named John dies. In the hospital corridor, Natalie spots a courier arriving to collect the return shipment of John's unused trial medication. The box sits in a bin, clearly labeled for Kender Pharma. Natalie watches as the courier asks for the package. She steps in immediately, lying to him that another staff member has already picked it up. Once the courier leaves, Natalie grabs the box herself. She smuggles the unapproved medication out of the hospital and takes it to her mother's home. Natalie hands the pills to her mother, claiming they are a new prescription from a different specialist. She watches her mother swallow the drugs, fully aware that the side effects are unknown and her actions are criminal. On the bedside table, the bottle bears Will's name, and the trial return label a physical record of her theft. Natalie has abandoned her professional ethics, gambling her career and her mother's life on a stolen bottle of experimental pills. Investigators find traces of accelerant at the base of both stairways in the burned building. The fire was not an accident. It was deliberate arson. Dr. Will Halstead stands in the hospital, processing the reality of the attack. While the initial suspicion falls on a man named Gorin, the police begin pulling security footage from the surrounding area to identify the real perpetrator. Will's colleague Dylan is consumed by guilt. He blames himself for the escalation that put Will in danger. Will refuses the apology, stating that his loss of property is insignificant compared to the human cost of the corruption they are fighting. He prepares for the legal confrontation involving the Vascom clinical trials. Will arrives at the courthouse wearing a suit pulled from the hospital's Lost and Found. He is there to testify against the corporate malpractice that led to this violence. On the courthouse steps, he encounters Jessa Rinaldi, the high-level executive overseeing the fraudulent project. Jessa remains composed, acting as though she is untouchable. The silence is broken when two police officers intercept Jessa. They arrest her in public view. The charges are read, aggravated arson, and the attempted murder of Dr. Will Halstead. Jessa protests, calling the situation a mistake, but the lead detective presents the facts. They have credit card records of Jessa purchasing the accelerant. They have surveillance footage of her entering and exiting the building immediately before the fire began. Handcuffs are locked around her wrists. Will watches as the woman who tried to kill him to protect a corporate secret is led away to a police cruiser. Eve Bennett arrives at the emergency room in a tailored business suit after a sudden seizure. Her husband tells the doctors she is a high-level executive who never misses a day of work. Dr. Hammer notes a fever of 102 degrees and visible jaundice. As the medical team prepares for a CT scan, a hospital administrator enters with Eve's insurance card. The policy is no longer active. Her husband hands over a credit card to cover the costs, but the machine rejects it. He tries a second card. It is also declined. The high-achieving couple is suddenly penniless in the middle of a medical crisis. Eve's health continues to fail. A Western blot test returns a positive result for typhus, a rare bacterial infection. The doctors find a small scab on her neck caused by a flea bite. They explain that typhus typically spreads in environments with heavy rat populations. Her husband is baffled, insisting their home is pristine. The pressure shatters Eve's silence. She begins to cry, admitting she was fired 3 months ago during a company restructure. She could not face the shame of being unemployed. Every morning, she dressed in her professional attire and left the house as if going to the office. Instead, she spent 8 hours a day sitting in their rented storage locker. She lived among boxes and filth where rats nested. The fleas from the storage unit bit her, transmitting a disease of poverty into her elite life. She traded her physical health for the appearance of success. Lawrence's body is shutting down. Hemodialysis has stopped working, leaving his blood saturated with toxins. He is at the end of the transplant list with no time left. His son, Luke, is the only viable donor present. However, Luke suffers from cognitive disabilities. When the medical team prepares him for the procedure, he suffers a severe panic attack. He is unable to provide the organ his father needs to survive. Lawrence is left to wait for the end. A man named Keith is rushed into the trauma bay following a violent car accident. He is critically injured and requires immediate surgery. Before the anesthesia is administered, Keith stops the surgeons. He makes a confession. 10 years ago, he killed a man in a bar fight and fled the scene. He has lived with the guilt guilt in silence ever since. Facing his own mortality, he gives a final instruction. If he does not survive the operation, his organs must be donated. He describes it as a life for a life, a final attempt to settle a 10-year-old debt. During the surgery, Keith suffers a catastrophic hemorrhagic stroke. Brainstem reflexes vanish, and he is declared dead. The medical team immediately initiates HLA testing to find a compatible recipient. The results confirm a perfect match with Lawrence. The transplant proceeds without delay. Keith's kidney is moved from one body to the other. The surgery is a success. A man who spent a decade running from a killing pays his debt in full, and a father is given the chance to return home to his son. Anel, a Haitian immigrant, arrives at the emergency room after a fall. His son, Emmanuel, acts as his translator. A head CT scan reveals significant hippocampal atrophy. The medical team confirms a diagnosis of early-onset Alzheimer's. Anel is only 45 years old. Emmanuel stops the doctors before they can disclose the findings. He describes his father's life in Haiti, a decades-long struggle against war and poverty. Anel has finally found freedom and is newly engaged. Emmanuel refuses to let a terminal diagnosis destroy his father's first experience of peace. He demands that the doctors withhold the truth and tell Anel the new medication, Donpezil, is merely for a balance issue. A conflict over medical ethics follows. Dr. Hammer argues that the patient has a legal right to know his future. Emmanuel remains unmoved. He brings his father's fiancée, Fabienne, into the deception. When Dr. Hammer confronts her in the hallway, Fabienne chooses to support Emmanuel. She explains that in their culture, the family protects the individual. To them, the truth is not a right. It is a burden that would steal Anel's remaining years of joy. The doctors debate the use of therapeutic privilege. They ultimately decide to remain silent. Anel takes his medication, believing he is being treated for a minor physical ailment. He smiles at his family and continues to plan his wedding. The medical staff watches from the hall, witnessing a family prioritize a fragile, borrowed happiness over the cold facts of a fading mind.